Hi, my name is Peggy Bettin. I am one of the neurology residents. My name tag says Margaret, but I go by Peggy. I'm here with John, one of the medical students here, volunteered to help me with our video for your neurologic exam. I'm going to show you a comprehensive kind of screening exam that I do on every patient I see. Depending on the chief complaint of the patient, I'll delve into, say, more coordination testing or more sensory testing, depending on what I'm looking further into. But the exam I'm going to show you is what I do on every new patient I'm meeting. So John, we'll start.
All right.
So I first start with mental status. I see you're alert. What month are we in?
It's June.
And the year?
2019.
And the date?
The 17th.
Perfect. And do you know what kind of building this is?
I believe we're in a hospital.
Okay. And sometimes I don't do a full mental status exam if I'm really not interested in that. But since I'm trying to teach a little bit about what we do, if someone is confused, I'll do some more testing here. So can you point to the ceiling after pointing to the wall? Perfect. Can you take your right thumb and touch your left ear? Great. All right, I'm going to give you 3 words. And you try to repeat after me. Apple, table, penny.
Apple, table, penny.
Okay, perfect. Now try to keep those in your mind. I'm going to ask you in a little bit later in the exam, okay? So tell me, can you say the days of the week backwards?
Sunday, Saturday, Friday, Thursday, Wednesday, Tuesday, Monday.
Perfect. Okay. Repeat the words. Do you remember the 3 words I gave you earlier?
Apple, table, penny.
Perfect. Okay. All right. And that's about it for the mental status exam. All right. So now I'll move on to cranial nerves. Can you look straight at my nose? All right. I'm just going to shine a light in your eye, okay? All right. I see pupils constricting and then the consensual pupillary restriction. All right, and then I'll swing back and forth. Okay, and that just checks for afferent pupillary defect in a multiple sclerosis patient, let's say. All right, now follow my finger with your eyes, and I like to stand back when I'm doing this, so they don't get kind of, I don't know, motion sickness if I'm standing too close. Okay. All right, and does this feel the same on both sides?
Yes.
All right. Can you raise your eyebrows real high? Close your eyes really tight. Open them up. Go like this. Keep out your tongue. Perfect. All right. Can you put your arms up, palms up? And then I like to just go down the body. So I usually do looking for pronator drift after the cranial nerve. So close your eyes and keep them up. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Pronator drift would look like this. And that's concern for an upper motor neuron weakness. But if it just raised up like this, that would be more concerning for, say, or down, a proprioceptive deficit in that right arm. So good job. So then keep your arms out, straight out, and close your eyes again. Now take this finger, touch your nose. All right, back out. Now the other one. And most patients have a little difficulty with that. You can open your eyes and relax. But if they have a very large or very big amount of difficulty with that, it's indicative of a proprioceptive issue in the arms. Okay, so now can you touch your nose and touch my finger and go back and forth. Perfect, and make sure they stretch their arm out completely. Now the other side, back and forth. Good. Good, perfect. All right, now can you put your arms like this? Keep them up. We're moving on to motor testing. Really strong. Don't let me push. Perfect. And then in that testing is the only one that we do bilateral arms up at the same time, because if you did one at a time, you'd kind of have that trouble with the other side of the body being off balance. So arms like this, and don't let me pull. So everything else is one at a time. Good. and I like to have the joint have one arm above and below the joint, so when you're testing for muscles strength. Now push away, good, and push away, good. All right, arms out, and actually, yep, and then pull your wrists back, good. Now we'll test wrist strength, good, and then wrists up, good. And I just kind of say to the patient, real strong, keep real strong, we're doing strength testing. Fingers out straight, keep your fingers flat and push up against me. And sometimes I'll say fingers out like little planks. And this is important because in an upper motor neuron response or weakness, you can get extensor weakness of the fingers, so that's pretty important. And then grip, or yeah, exactly, and pull, and squeeze my fingers as hard as you can. Don't let me pull them out, perfect. And then this one, good. So now we've done motor in the arms. And then if I'm not worried about a sensory complaint, and if it's a stroke, you would have a large amount of sensory loss. So I just say, does this feel about the same on both sides?
Yep.
Good. And then I go down to the legs. Does this feel about the same on both sides?
Yep.
And that's really all I do for sensory, except for the proprioception that I'll be testing in the toes on a screening exam. All right. Now finish, as I kind of continue my path down the body, can you lift your knee up at the hip, and you can balance yourself side by side, and real strong, keep your knee up. And now this one, knee up, perfect. Now straighten this leg out, and keep it straight, and don't let me push. And this again, I'm one hand above and below the joint. And straighten out the leg, yep, and don't let me push, perfect. And that's kind of how we'll do knee extension and flexion. Pull in and pull in. Perfect. Now heels up, or toes to your nose is another way people like to say it. Push up against my hand, push up against my hand. Now push down on the gas, push down. Perfect. And heel, dorsiflexion, plantar flexion testing is better doing heel and toe walking, which I do, and I will do in a little bit. All right. So now I'm just going to tap on your reflexes, but before I do that, make sure you don't forget tone testing, which is also very important for neurologic patients. So I just kind of grab their hand, kind of jiggle it around because people tend to tense up. And then I kind of say, just relax, relax as best you can. People really have trouble relaxing. So that'll be hard because dementia patients tend to have difficulty relaxing as well, and they can be what we call paratonic. So they'll kind of like go with the movement when you're testing them, and you'll think they have increased tone, but they're just kind of resisting you because they have dementia, and we call that paratonia, so it can be tricky. But nice normal tone here, nice normal tone here, I'm assuming. All right, and then the best way to test tone in the legs, I'm going to have you turn your body this way with your legs up, actually on the bed here, yep. And then just relax your legs or lean back a little bit, but I have you just stay real relaxed. I'll pull up at the knee just a couple times, and then I'll briskly pull up once. And then if your leg was spastic, what it would do is, here I'll come to this side. If this leg was spastic, I'd pull up, and then when I briskly pulled up, the whole leg would come off the bed. But your ankle stays on the bed even when I briskly pull up. So that's the best way to test for tone. All right, you can come back over this way. But to substitute that, sometimes I'll just kind of quickly grab their leg and kind of move it around, essentially. Okay, so now I'll do your reflexes. All right, so keep your palm up in your lap here, and then I just feel for the biceps tendon, and I tap. I don't have very brisk reflexes, but that's fine because what you're really looking for is symmetry. And then I always go for the pectoralis, and that's an upper motor neuron sign. Often people are brisk. I probably have a pectoralis myself, but I'm looking mainly for symmetry, but often if this is there and really easy to get, that's going to be a 3+ on that right arm. And then here too, feel for the brachialis. So it's not super brisk. 2+. All right. Okay, again, patellar tendon I'm feeling for. And then we'll do cross adductors here. And that would be evidence of a 3+ hyperreflexia. If, when I tap here, so I feel for the patella, I kind of go a little bit more medially to that, and I tap my fingers, and what I'm looking for is the crossed adduction, so meaning this leg would adduct in, and that would be a 3+. And then I'll just do the ankles. So I kind of pull their ankle up a little bit, and then I tap. And there it goes. It won't work if it's down or they're resisting you in any way. Any of the reflexes won't work if they're not relaxed. There it goes. All right. And then I check for clonus. So I kind of wiggle their foot around so it's relaxed, and then I jerk up. And there's just a beat, which is normal. A beat to none is normal. I did not mention in the cranial nerves when I was having you look this way and that way with the H testing that I often have someone look to the left and hold, especially if I'm looking for nystagmus. It's just something else to mention. All right, so I'm not quite done with the testing. Will you, before I have you take your socks off, this is how I run through it. Do you mind walking for me? I'm just kind of walking back and forth here. First, your normal gait. Perfect. And when you turn around, can you walk heel to toe like you're on a tightrope? So this is tandem gait, and he's casual tandem gait, doesn't have any step off, lateral step off. Perfect. Turn around. And then this is strength testing, so can you walk on your heels and your toes? It's not supposed to be a balance test, so if they have trouble, that's perfect. And turn around. And then toes. Perfect, and walk forward. Perfect. All right, and then turn around again. So if you had trouble balancing, what I'd say, I'd put my arms out, you go on your heels, and I just help you balance, essentially, because it's just for strength. All right, now stand with your feet together and close your eyes. And I do this because it really helps with the proprioception, since I'm just doing screening. Perfect, and you can open your eyes, and now you can sit down. And then you can finish off with heel to shin if you like. Up and down, and the other side. Perfect. That's great. Now will you take off your toes, and we're almost done. Or take off your socks. Excuse me. All right. So I'm gonna have you close your eyes. And tell me, I'm going to wiggle your toe up and down, and you grab the sides of the toe, and tell me if your toe is up or down.
All right.
Is it up or down?
Down.
Okay. Up or down?
Up.
Same thing over here. I wiggle it a little and hold it on the sides, not on the top and bottom. Is your toe up or down?
Up.
Toe up or down?
Down.
Perfect. And then the last thing I do, you can open your eyes, is the Babinski, and I say this is kind of uncomfortable. It's a tickle, but it's also kind of scrapey feeling, okay? Try your best not to pull away if possible. All right, little scrape. And then toes down. And I do this side too. And then when I'm scraping along the lateral side of the heel and then medially. All right. Thank you so much.
No problem.